Welcome in to everybody who is watching on 9 News Plus on KTVD tonight. We want to talk to Denver Health CEO Donna Lynne, who joins us now. And Donna, you guys are up double digits at this point, less than 50% of the vote in, or so we think. Do you believe that you all are going to get the cash influx from voters that you'd asked for?
I think we are. We're cautiously optimistic. So far, the results are very positive from our perspective. And I think what we've heard more and more is people understand more about the challenges Denver Health has. And that, quite frankly, is a victory in and of itself.
Did you think that you were going to have a more difficult time getting this sales tax measure before voters when the mayor and city council then put on a second sales tax hike to benefit affordable housing? You have to imagine that there were some Denver voters out there who felt like they had to make a choice between the two.
I don't know if they made a choice between the two. I hope our story was compelling enough, and quite frankly, we touch about 280,000 patients a year. We hope they all voted with their feet to support us. It did make the conversation more complicated, as you know, because the combination of the 0.34 and the 0.5 took Denver Health to a place that was, people were talking more about how close we were getting to 10%. And honestly, we think we pay back to the voters in many more times over than what that sales tax increase results in.
Donna Lynne, CEO of Denver Health, one final question for you here, as currently your sales tax measure to pay for uncompensated care at the hospital is up by a double-digit margin with about 40% of the vote in. When Donald Trump came to campaign in Aurora, he did not mention Denver Health by name, but he certainly was talking about your safety net hospital when he falsely claimed that people could not get a bed at Denver Health due to migrants being cared for there, and suggested that your financial difficulty was solely or largely due to caring for migrants. What would you tell the public about those claims by former President Trump?
I'm trying to think of a polite word to use, but let me just say this. Less than 2% of the visits that we have at Denver Health are for people who are undocumented. And quite frankly, many of the people that came here through Venezuela and other countries, may have had infectious diseases that could have had serious impacts in our schools and in our community. So treating them was just a sliver of the issue that we face. Quite frankly, Denver Health for 164 years has struggled with the substantial number of people in Colorado who are uninsured. There's actually 330,000 people in Colorado who don't have insurance. They work in retail jobs. Maybe they're in the gig economy. The migrants are just something for political people to wave a flag about, and we absolutely, even if the migrants hadn't come, we would still be pursuing something like that to take care of our kids in our schools, who we don't charge any money to, and they get lots of services, behavioral health, substance use, regular physical exams. I think the public doesn't really understand the breadth of what we do, and the migrant simply becomes a red herring.
Denver Health CEO Donna Lynne, appreciate your time tonight. Again, that sales tax measure to benefit Denver Health and help it pay for uncompensated care is up double digits in the early going.